Welcome everybody, and I want to introduce myself. I'm Jana Langhorn. I'll be your moderator today and your webinar organizer. Before we get started, let's take a moment to ensure that everybody is ready and familiar with the webinar control panel that's on the right side of their screen. And then you will see that there's a question section where you can type in any questions to send to me, and at the end we'll address as many as we can, just depending on how much time we have. And now that we have had that covered, I want to go ahead and introduce today's presenters. The first person that you will hear from today is Helen Oscislawski. She is the founder of Attorneys at Oscislawski and is a corporate and regulatory attorney whose practice focuses almost exclusively on advising and representing healthcare clients. She was appointed to the New Jersey Health Information Technology Commission in 2008 and served as chair of the State Privacy and Security Committee for the New Jersey Health IT Coordinator. Our second panelist today will be Matt McMillan. He's the co-founder and CEO of CynergisTek and is the chair of the HIMSS Privacy and Security Policy Task Force. McMillan brings over 30 years of experience from both government and private sector positions, and he has worked in the healthcare industry since his retirement from the federal government. He regularly contributes thought leadership in healthcare publications around compliance, data, security, and privacy. Our third panelist is Jerry Blass, president and CEO of COMPLYASSISTANT Comply Consult. He has over 35 years of experience in healthcare IT and compliance and formed Blast Consulting in 2001 to provide professional consulting services for healthcare IT. He then later formed Blast Compliance in 2009. He co-authors quarterly columns for JHIM and co-founded the LinkedIn group HIPAA 411. Today, the three of them will provide an overview of the Omnibus rule as enforcement approaches. They will address the impacts it has made to the relationship between covered entities and business associates and why it's now more important than ever to have vendor security management in place. With that, I'll turn it over to Helen.
Thank you, Jana, and thank you to the attendees for joining us today. We are very excited about giving you an overview. There's a lot of changes that have taken place, and with a lot of the information out there, we hope to bring a focus on business associates and some of the issues that are unique to them. So as I'm sure you all know, the long-awaited and anticipated final rule was promulgated this past January. It was released on January 17th and published the 25th. I've provided a link for you there in the event that you want to download and have that for your references. A lot of times the preambles to these rules, especially the final rules, provide a lot of insight into the regulating agency, which is the Department of Health and Human Services in this instance, provides some insight into how they interpret and how they view, and provides often examples of things that can provide insight into interpretation and scenarios for you. So I recommend and I encourage those who are subject to these rules to give them a read, if you will. The compliance deadline is literally around the corner. It is September 23rd, 2013, to have all of the changes brought about by HITECH updated and finalized for covered entities and those who have been subject to these rules for years now. From a practical standpoint, what that means is updating their already existing documents and policies, but for business associates and their sub-vendors who have been delegated services and functions on behalf of BAs, this is a huge undertaking because for the most part, this is a first time foray into full compliance, at least with the security rule, and a lot of them could be overwhelmed with the process and the things that they do and do not need to do for the first time, including appointing appointing security officers, getting security assessments done, and getting their hands around compliance with the security rule. So not a lot of time left. Specifically 33 days left, so for those of you out there who are scrambling, hopefully this webinar will provide you some direction and a little bit of direction as to your focus areas, and it will help you along. So next slide. There's a couple of areas that business associates should be focusing on. If we could just move to the next slide. The focus areas, I'm sorry, one slide back. The focus areas for business associates would be for, what are your HITECH and HIPAA obligations? Specifically, you need to comply with the HIPAA security rules, so that will take a lot of focus there and effort, because that entails developing and implementing your written policies, appointing, a security officer, completing a full security assessment with regard to your systems and where EPHI is stored and how it is transmitted and held. It also requires certain compliance with the privacy rule. You need to take into account your business associate agreements with your covered entities, as well as now your contracts with any subdelegated services for your sub-vendors. Those not only need to be papered with a similar kind of business associate agreement, but of course, business associates are now generally in a more I guess, a position where they probably will need to be taking a closer look at who they're delegating certain services to in terms of their sub-vendors, because as we'll discuss later in the presentation, they're on the hook for non-compliance by their sub-vendors that will leak back up to them, and certainly it behooves them to ensure that whoever they're using is holding their standards of security to a similar level that the BA requires of itself, and then the covered entity for that matter requires of the business associate. Business associates also will need to focus their attention on the security breach notification to which they are directly subject to. That whole process involves not only identifying when a breach does occur and ensuring that your employees notify you of when those breaches occur, but then appropriately responding to those and coordinating with the covered entity how notifications and whatnot need to occur. And that ties into also the business associate agreements. That's a large area. Security breach and notification, how to handle that, are a number of provisions that are typically handled in the business associate agreement. But in addition to that, you want to, as a business associate, ensure that your agreements are technically compliant, of course. And then is the other stuff. What is optional? Often you'll find a lot of language in there. If you're obtaining the BA from the covered entity, there may be clauses in there that are intended to protect the covered entity that may not be something a business associate wants to agree to. On the flip side, there could be language that the BA would want to put there to manage its own risk and liabilities for its services. So there's a number of optional provisions that we'll touch on later in the presentation as to what you may want to put in there in addition to what's technically required as a matter of technical compliance. So next slide. So one of the interesting topics, can the real business associate please stand up? Next slide. I have been running into this with more frequency, interestingly, because of course the implications that business associates are directly responsible and liable for compliance. And I've run into not a small amount of situations where business associates simply are digging their heels in and maintaining that they are not business associates. And in some cases they may be right. In some cases they're wrong. It's important to understand that whether or not you are or are not a business associate, while there may be a little bit of wiggle room for interpretation, for the most part either you are or you're not. And there are clear legal definitions, I think they're pretty clear legal definitions that will dictate or tell you what you need to look at to determine whether the functions that you are performing render you a business associate subject to HIPAA compliance and enforcement or not. And I provided a citation here. It's within the privacy rule and it's within the, I guess, the HIPAA regulations. And the definition is essentially any person or entity who is performing a function on behalf of a covered entity or on part of an organized healthcare arrangement, and it needs essentially access to protected health information, including paper or electronic format, to perform that function or activity on behalf of the covered entity. A business associate does not include workforce of the covered entity, so if you're a direct employee of the covered entity, then you would not be a business associate, rather you would be an employee or an agent of the covered entity. But if you are subcontracted or contracted to perform a service or function on behalf of the covered entity, and that service requires you to access on a regular basis PHI in order to accomplish that task, then you are a business associate. Now, there's other more detailed definitions that you could take a look at. They've, of course, given example: legal, actuarial, accounting, other kinds of types of services, data aggregation, other things. So, you know, the point here is to understand that for a business associate is just as important to understand that you get this conclusion correct, because if you are a business associate, digging your heels in and simply adamantly refusing to acknowledge that you are is not going to somehow remove your responsibility for compliance if OCR says by definition you are a business associate. So move to the next slide, please. With the HITECH final rule, we got some further clarity in the next slide, if we can move. The HITECH rule specified and expanded and made it clear that entities such as health information organizations, regional health information organizations, e-prescribing gateways, and even personal health record vendors that are providing a service on behalf of a covered entity could all indeed absolutely be business associates, okay? And in fact, they also went on in the HITECH final rule to clarify that any entity that transmits PHI or requires access to PHI on a routine basis would be deemed a business associate. I've seen or come across a number of cloud vendors who maintain that they are not BAs because they simply provide the software that allows for the storage of the PHI or are merely the conduit for the PHI. HHS made it clear in the preamble that hosting PHI, hosting any data on behalf of a covered entity renders you a BA, and with regard to transmission, while they did carve out that conduits would not be BAs, not all transmission simply because you're routing the PHI does not simply render you a conduit. You need to take a look at how that transmission occurs. Are you regularly accessing it? Do you have the capacity to access it? Does the BA need to access it to troubleshoot, to manage, to upgrade, to do anything on behalf of the covered entity? If there is routine access, then you may still be a BA even though you're simply facilitating the transmission. On the other hand, if you are simply the plumbing that is allowing the transmission to occur, i.e. you're a Comcast or a Verizon that simply provides the cables, or i.e. you are a HISP that simply provides an absolutely totally encrypted transmission that you do not have any access to, then perhaps you are a conduit. Very important to get those things right and whether or not you are a BA. Next slide. The subcontractors, don't forget now, post-HITECH, everyone down the stream is on the hook for compliance. So any entity or person that creates, receives, maintains, or transmits protected health information on behalf of the business associate is now also on the hook for direct compliance with regard to those activities that they're engaged in on behalf of the business associates. That is true even if you do not apply or you do not enter into a BAA. You are a BAA or a sub-BA by fact of what you are doing, okay? It attaches to every downstream subcontractor who needs to access the PHI that the BA is giving to the sub or the sub is giving to their sub in order to perform the specific function on behalf of the BA. The OCR and OCR can directly enforce against sub-BAs and everyone down the food chain for non-compliance. Next slide. So the question I also get, because the BAs, there's often, not often, but the more regular, there's BAs just do not want to sign the BA because they think that if they sign the BA, now they've somehow subjected them to compliance by OCR. And again, the absence of, and in fact, HHS made this clear in the comments in the preamble to the final Omnibus rule, that if you simply refuse to enter into a BA agreement, while that may be a technical violation of a requirement under HIPAA-HITECH for a matter of technical compliance, it somehow does not negate the fact that you are still a BA subject to full compliance. So avoiding signing a business associate agreement as an attempt to avoid business associate type or HIPAA compliance and enforcement will not work. You are a BA by the fact of the matter of what you do and how you access PHI on behalf of a covered entity. So you cannot avoid that compliance simply by not signing a BA. On the other hand, just because you're not a business associate does not mean that HIPAA is not relevant. On the flip side, sometimes I see, actually quite frequently, I see situations where maybe a third party wants to access personal health information or PHI of a covered entity to perform some kinds of services that are technically not BA services. They are technically considered disclosures. To paint a, I guess, a strong point, perhaps a third party wants to gain access to PHI demographic information to perform marketing of services that they provide. Well, you cannot somehow make that kind of relationship okay by slapping a BAA on it. You have to take a look at what the service is, on behalf of whom you're providing that service, and if you are a vendor who wants access to PHI to perform or do something with the PHI that's not on behalf of the covered entity, you cannot make that activity okay or the disclosure of that PHI okay simply by papering it with a business associate agreement. You know, HIPAA is still relevant with regard to that disclosure, and you would need to evaluate whether, for instance, authorizations from patients are first required. So it's, you know, the absence or the presence of a BAA is not dispositive of the legal issues. Okay, next slide. So security breach notification. So the first step, as I, I highly recommend taking a look at yourselves and your relationships and your vendors, and first reevaluating: am I really a BA? Who are my subs, and are they subs, and so on and so forth. The second category I would highly recommend you diving into is security breach notification. Next slide. Now, we know with the next slide, it says that we've seen the security breach notification interim breach rule for a while now. In fact, it remains in effect. And in fact, business associates and covered entities today and right now are supposed to be complying with all of those elements of the interim breach rule. And right now, what is effect, at least through September 23rd and continues to be effect, is essentially that if there is a breach that is unauthorized, and that means the unauthorized acquisition and access of information, PHI, that's in a matter that's not permitted by the HIPAA privacy rule, and that compromises the privacy and security of the information. And the interim rule allowed us to evaluate whether that access and that breach poses a significant risk of financial, reputational, or other harm, often referred to as the harm test. If it doesn't pose that kind of harm, we were permitted, the covered entities and BAs, to document our assessment and our evaluation and our conclusions as to why we've concluded there is no harm, i.e. maybe we've completely and totally remediated the harms, or maybe we felt like, you know, there is no harm to the individual. We were able to document that and make a determination and judgment as to whether or not notification needs to occur. After the final rule and a lot of controversy and a lot of discussions and a lot of open forums and a lot of comments submitted and a lot of responses, the bottom line here is that we've removed that, or HHS has removed that significant risk of harm evaluation and that test, and replaced it essentially that you have to presume that any potential or actual unauthorized access to information needs to be presumed that it is a breach unless you can affirmatively demonstrate that there's a low probability that the PHI has been compromised, and we'll go through the test. The burden of proof essentially is for you to prove and show with certainty that there is really a low probability, and so that burden of proof is on you. Next slide. The first step in evaluating an incident, you learn, business associate, you've learned something happened. So you first want to take a look. First of all, we know that covered entities and business associates are covered. We know that protected health information as a whole, including paper, electronic, it also includes oral information. So if somebody leaks something and blabs something to someone, that can be considered a breach. With regard to who and what is covered, nothing changed as a result of the Omnibus rule. Next slide. And we would move then to evaluate whether or not the incident is a breach. A breach is defined, you can see here I've sectioned off under high-tech, unauthorized acquisition of PHI that is unsecured, okay, and the use of disclosure is in violation of the privacy rule, and the change here again is that we've moved, everything stayed the same except now we've removed the compromises of security, which is the harm test, and moved to the presumption of breach. Secured versus unsecured, we know that if the information was completely encrypted or it's unusable, unreadable, undecipherable, there's destruction standards, or it's been destroyed or protected per NIST standards, but most often we look at the encryption standard when we're dealing with electronic information, then you're in the safe harbor where it's not considered a breach. That remains the same under Omnibus, okay? And the compromises assessment, again, removed risk of harm. We need to prove and do the four-pronged test to demonstrate and document whether or not there's a low probability of PHI. So we presume that it is a breach. We presume we have to notify the person in the agencies, or in case of BAs, the covered entity, unless we can prove there's a low probability. So if we can take a look at the next slide. There are a number of exceptions that presume that it's not a breach. I'm not going to spend too much time on them, but you can look in them. My personal feeling is the unintentional, inadvertent, retention on possible are very narrow exceptions that don't generally have broad applicability to your normal incidents that occur. Things that move or somehow PHI that's accessed outside of the organization will almost never fall into any of these exceptions. Access or inadvertent access within the organization at times may, or mailings that are not open, like mailed letter with PHI that is returned back, can fit into the safe harbor. But in general, the rule of thumb here is that these safe harbors and exceptions are pretty narrow and have a pretty low scope of applicability to get you out of compliance. The knowledge factor, just to understand, it's important that if your employees know about the breach, you're imputed to know. So next slide. So here for you, just to take a look, you can take a look when you evaluate whether the PHI has been compromised. You need to go into these four factors, take a look at those four factors. Take each one. I've provided you here some of the thoughts from the preamble of what the assessment involves. Document each one. The rule of thumb is if you come out positively on all four, then perhaps you can conclude that there's a low probability. If you come out high on any one of these, that there is a risk, then you will need to err on the side of notifying. Next slide, please. The next two slides, just real quickly, just to summarize, the business associate has to notify the covered entity. That is the only individual or the only entity that you need to notify. You need to notify the covered entity. With regard to the other notifications, including the individual, you do not need to notify those unless you have agreed with the covered entity otherwise. And that's usually something you negotiate and you put into the business associate agreement. Next slide. And finally, how you need to notify. Again, just to summarize, typically how the business associate needs to notify the covered entity is something that's addressed in the business associate agreement. The covered entity has very strict regulatory guidelines where they need to notify the individual within 60 days, that they can delay only in certain circumstances, and there's certain very specific content that they need to put into the notifications. So to the extent that you as a business associate are responsible for the breach, the covered entity will be looking for that information from you. So typically you'll see, how quickly you need to respond, how quickly you need to notify the covered entity. That will all generally be laid out in the business associate agreement. Next slide. So then in summary, as I'm tying up and I'm wrapping up, it's important for you to understand that the business associate agreement, if we can move to the next slide and then to the next slide, that the devil is in the details. In the next slide, I've listed out for you 5 bullet points. These 5 bullet points represent the only things that have changed as a result of the high-tech revisions. If you have a HIPAA-compliant BAA in place, check it to make sure that these 5 bullet points have been included because they're required as a matter of revision. In the next slide, you can take a look that you understand that those BA agreements need to be updated and in place by this September 23rd, 2013, unless they're in place already, in which case you have a grandfathering grandfathering period of up to 1 year. If you're entering into agreements right now, they must be fully compliant, and if they're not, then you need to have them compliant, so you will need to redo them by September 23rd, 2013, within 33 days. So you might as well get the BA agreements up and compliant in place. And with the last slide, just to wrap up, here are some of the hot negotiation issues that I see. We've discussed, am I a BA or am I not a BA? Do we need a BAA or do we not need a BAA? You know, we've discussed the importance of getting the determination right and the fact that the BAA and the absence of the BA or presence is not dispositive. You need to define in the BAA the services and functions that you're providing on behalf of the covered entity. This is both important for a matter of compliance purposes and for clarity purposes. The agency issue, whether or not you are an agent of the covered entity for purposes of notification is crucial. Security assessments and whether or not you have to perform them and provide them to the covered entity. Sometimes they require that. That, you know, is something that sometimes finds its way into BAA agreements from covered entities. The breach notification timeframes, whether or not you should be required to encrypt all data you receive from the covered entity in order to avoid notification, how you can use de-identified data, whether or not you can use foreign sub-agents, whether you should get cyber insurance, and what are the indemnifications between the parties for those wrongdoings, breaches, penalties, and lawsuits, and who should be paying for that. And then last but not least, state law issues, and to the extent that state law must be complied by the BA. These are all negotiation issues that I see regularly, and you know, that you will probably see cropping up, and that, you know, you should either get an attorney to help you negotiate these issues or to address them so that you're not put in a position that puts you at risk. Okay, with that, I turn it over to Mac, who will give the next half of the presentation. And you can skip that last slide.
Thanks, Helen. I appreciate that, and I can't tell you how much. I know Helen's now offline and muted, and she's probably getting some oxygen. I'm giving a regional seminar later this afternoon, and I have 3 hours to go over all the changes in the Omnibus rule. She just summarized the ones that pertain to a business associate in a little over 20 minutes, which was quite an accomplishment. So thank you for that. And with that, let's talk about what this means for us operationally when we start talking about how do we change what we're doing to incorporate these new requirements and protect ourselves with respect to the liability that we have in this relationship with our vendor partners who are so critical to our organizations. So we're going to talk about vendor requirements, our vendor security requirements first. And there are several things that I put in this vendor security management program, if you will, that I learned firsthand when I was managing security many years ago at the agency, and we had probably well into 500 different vendors that supported the agency on various programs that were anything from very simple administrative technical programs that required no access to sensitive information, all the way to very sensitive relationships with vendors who were doing things even in the top secret and code word world for us. And we had fairly elaborate processes that we had to follow to make sure that we were protecting that data properly in both ourselves and those vendors. But the requirements are fairly simple and very similar in the sense of how you would construct a program. Even though at the end of the day, the situation is very different. So in the first part of this process, we're going to look at how we define requirements for that vendor management or for that particular relationship. And what we're talking about there is what exactly is involved in this particular contract. What is the contractor doing for us? What type of service are they providing? What level of access do they require? Do they require a retention of data? Is it going to be off-site? Is it going to be on-site? What's the transport mechanisms, etc.? What are the requirements for them to perform whatever service it is that they're performing on our behalf that we need to pay attention to from a data security perspective. The second part of our program is to ensure that those requirements then are reflected properly in our solicitation, in our RFP, RFI type documents and processes, so that those vendors who apply for that particular effort are ones who can demonstrate that they have the wherewithal to meet all of our requirements, not just from an operational perspective or a clinical perspective, but that they can also meet our requirements from a security and privacy perspective. After that, we then need to make sure that once we are in that selection process and we have selected the vendor of choice, that we then pay attention to ensuring that those pertinent privacy and security requirements are included in our contract and our business associate agreements. And Helen, of course, went over some of those right there at the end. And there are some others, though, from an operational perspective that we would recommend from a security perspective in terms of just understanding what's going on with our data at that contractor site and how well that data is being managed. So, for instance, the requirement for the business associate to provide a business associate agreement to any subcontractors that they might sublet part of the process to. One of the things that I would want to make sure was in my business associate agreement or in my contract document, if I had a security specification document as part of it, is I'd want to know who those subcontractors are, and I'd want to know anytime our data is being transferred from that primary business associate that we have signed a contract with to a subcontractor, so that I'm not surprised down the line when something happens and I find out that it's a third party that I didn't even know existed. Things like notices to outside parties or providing our information to HHS in the event of a investigation, they have a responsibility to do that. One of the things that I would want to know anytime that they provide our information or my information to any third party, whether it's the federal government or otherwise, is that I be notified that had occurred, so that I know what's going on, and again, I'm not surprised by anything. And then last but not least, one of the other examples I would give is changes to the business. So businesses are constantly changing. They're changing location, they're changing facilities, they're changing how they do things, etc. One of the big changes that a lot of companies are going through now who are retaining information is moving data out of their own data center and into someone else's data center or to a cloud vendor for things like storage and retention. Again, if I have a contract with a business associate that has them hosting one of my systems or part of my data, if they make any kind of material change to their business where that information is physically moving or going to another location, I'm going to want to know about that before that happens. And those are the kinds of things that we need to make sure that are included in those agreements as well from a security and a privacy perspective. And the next phase after we've contracted with someone to provide this service is to conduct what we call performance monitoring, or basically to monitor that contract and their performance against those contract requirements over the life of that contract. And for contracts that are less than 12 months in duration, we typically don't have pronounced monitoring requirements. For contracts that go beyond 12 months, long-term arrangements where we have someone hosting our system or hosting our data, it is important to make sure that we periodically touch base with that organization to have them update whatever documentation or whatever information is pertinent with respect to what they're doing for us, as well as any periodic information that they should be providing to us based on our requirements with respect to how they're managing our data, so that we have a good sense that our information is being protected and handled properly. And then finally, at the end of that contract life, we have termination, and there should be very defined and clear requirements and expectations of what happens at the end of a contract. Is the data returned? Is the information destroyed and a destruction certificate provided? How do we eliminate accesses that may be in place at that point, etc. So there ought to be a very defined process for terminating that arrangement and making sure that the data is protected beyond the life of the contract. One of the other requirements, and Helen talked about this, was the security incident management and breach notification. This is a team sport, right? This is one of those areas where when a breach occurs, if it occurs at a business associate, the business associate is not the only one that's going to have to go through this process. The business associate has very definite requirements for them with respect to breach. One of those requirements from a notification perspective is that they notify the covered entity. But the covered entity has responsibility for making all the other subsequent notifications unless they have somehow transferred that through the contracting process to that particular vendor. If they haven't, they need to make sure that they have a process in place to be able to go through this risk analysis process and notification process with the vendor, so that when the vendor has a breach, they notify them very quickly, so that they both can get ready for all of the notifications that may be required within that 60-day window. The other thing is that since the covered entity is going to be the one who ultimately has responsibility for those notifications, you're probably going to want to know exactly what's going on with that breach and any investigative efforts, as well as be part of that risk assessment to determine whether or not the likelihood of compromise was low, and whether or not notification is required. And last but not least, as in any compliance requirement, we always have a documentation that we need to pay attention to. So there's documentation with respect to the security requirements, there's documentation with respect to the contract and the business associate agreement. There is other documentation that we are expected to have as well if OCR comes in and conducts a review or an investigation or one of their random audits, and we'll talk about that in a minute. But these are the five phases, if you will, of vendor security management: define, select, contract, monitor, and terminate. Next slide. So what are our expectations? So as Helen said, we have new requirements under the Omnibus rule. Actually, we have basically expanded requirements under the Omnibus rule. And the expectations for managing business associates are more pronounced now. One of the things we saw firsthand last year as we participated in several of the OCR random audits for compliance was that they looked very closely at vendor relationships and business associate agreements, both from on the privacy side as well as on the security side. And on the security side, they looked at areas that I think a lot of people were somewhat surprised in terms of the kinds of information that they were requesting to determine whether or not we were actually compliant with the rule as it relates to not only issuing business associate agreements to those folks who we provide or allow to perform tasks on our behalf with our information, but also some of the things that support those relationships, to include the definition of minimal necessary as it relates to that particular contracting effort. So some of the things that they looked at from a post-contract maintenance and administration perspective included things like incident management in terms of how that process was handled between the covered entity and the business associate. Backup and disaster recovery. They wanted to know if the covered entity had evidence that the business associate had proper processes in place to back up any data or systems that had PHI in them that the business associate was hosting on behalf of that covered entity. Physical protection, same thing. How are they protecting the data and those systems that they're supporting? Access control, who's accessing the data? Accounting for disclosure, something that has not come out yet with respect to the final rule. Obviously, the initial rule is still in place, or the first rule is still in place. But they looked at that process for accounting for disclosure, because now under the Omnibus rule, business associates have a responsibility to support that process. And last but not least, things like media, data disposal, and accountability of systems. If the vendor had a role in any of those processes. So there were things that OCR looked at that basically gave rise to the expectation that we are going to actually have an active vendor security management program in place that goes beyond a simple contract and business associate agreement. Next slide, please. So when we look at, let's look at those requirements from an administrative perspective first. So on the administrative side, like I said, the requirements for really managing vendors properly is for us to be able to first classify them, meaning what level of security is required for this particular vendor. Are they a vendor who would merely have indiscriminate access, meaning they're not supposed to have direct access, but could, by virtue of what they're doing and proximity of where they're doing it? Are they a vendor who will have access but shouldn't be storing or transmitting or manipulating the data in any way? Or are they a vendor who will actually be receiving data, maintaining data, and transmitting it on our behalf? Those three very different scenarios and environments, and the requirements for each of those may be very different based on those classifications. So that first step is classifying who our vendors are and what exactly they're doing. Then determining what security requirements are associated with that particular classification. And last but not least, defining minimal necessary as it relates to that contract, meaning what level of access should this contractor have and whether or not they should be able to retain or process or whatever it is they're supposed to do with respect to the contract or the service that they're providing, and just the minimal amount to be able to do that, as opposed to in the past where in some cases it was simpler just to give them access than it was to actually provide them access to what they needed, which is something I think we're going to have to pay more attention to going forward. And OCR has promised that there will be further guidance on minimal necessary later this year or early next year. The solicitation RFP processes, one, the development of those documents, development of those requirements, as well as the pre-contract evaluation process, meaning how do we go about evaluating those contractors to determine which ones actually meet our requirements from a privacy and a security perspective. Contracts and agreements, again, being able to define those security requirements for our procurement folks so that those things are included either in the contract itself or in that BA agreement so that we're adequately covered. Next slide. Operational, this is where we get into that performance monitoring part of the program or the process. And we have updating documentation there as required, meaning if they provided an SSAE 16 level 2 survey at the beginning of the contract and it's a 3-year contract, we probably want them to provide an annual update to that documentation. If they provided an evidence of a third-party risk analysis in the first year and say they're hosting our EHR or hosting our EMR and we have an ongoing requirement to conduct risk assessment or review a risk assessment on an annual basis as part of our meaningful use requirements, then we're going to want them to update that documentation on an annual basis. So there's ongoing documentation and updating of documentation that we're going to have to pay attention to. Backup and recovery, if they're hosting our data and they're conducting backups or recovery exercises or recovering processes, we're gonna need access to that information as it relates to reports or documentation covering that if we are requested to provide it during an audit or during an investigation. Physical security, we're going to want to know what's going on with respect to the physical security around their facility and if there are any changes to that. Any external requests for information, of our information in particular, we're going to want to be notified of those. And as I said earlier, any changes to their business. If they suddenly decide that it's cheaper for them to host their data in the cloud, then we want to know that before they take our data with them. Incident response, obviously we want to make sure that we cover notification as it relates to when they have to notify us, the risk analysis process and how we will participate in that process with them if that's what we choose to do. cleanup and remediation, how that will be handled and who will be responsible for that, and finally the notification process if it comes down to that. Last but not least, on the operational side is termination of the contract, and again we're talking about disposition of the information, and of course workforce turnover and access that workforce members had to our systems and to our information during that contract, making sure that that access is also terminated once the contract ends. Next slide. Last but not least, we have documentation that we need to pay attention to, as I said earlier. So those security questionnaires that support that vendor due diligence while we're in the selection process, IT environmental surveys, which do the same thing in terms of understanding what their IT environment looks like, solicitations, RFI documentation, RFP documentation, development of those and making sure that the right security requirements are embedded, contracts and business associate agreements, making sure again that the right language is in those agreements based on the classification of the vendor, and other supporting documents that we may request or require from time to time, such as access lists of who has access to our information or to our system, workforce training in terms of whether or not their workforce is trained properly, risk analysis, security assessment of their environment if they're hosting our data, and records of things like destruction, release, maintenance, backup, etc. And last but not least, incident reports. All of this documentation are things that OCR requested during their OCR random compliance audits last year of covered entities. So these are things we need to think about in terms of making sure that we have either access to them or we are retaining them in some way. Next slide. So what are the challenges to doing this for most of our folks, and what are the benefits of having an organized program to be able to manage this function? Well, the first challenge, of course, is that many of our covered entities don't have a few business associates. They have hundreds of business associates, and in some cases, very large organizations may have thousands of business associates. And that in and alone, just volume alone, makes this a very difficult program now with the new rules. The second part of it is the resources that are required to actually manage this process effectively and efficiently within our organization. So we're going to have to get a handle on who all of those business associates are and whether or not whether or not we have these requirements covered. We're going to have a way to request and retain this documentation and update it over the life of the contract. We're going to have a requirement for ongoing reevaluation and assessment of long-term contract relationships. It's going to be difficult for us to apply any form of a standard of care when we're not seeing across the industry what other folks are typically doing. And there is an FTE requirement here that once we enter into this process of developing the program for managing this effectively, that is going to hit us squarely operationally. So the benefits of having a program to do this are also many. The first one is having an efficient way of assessing and managing those vendors. The second one is having a structured system for classification that's based not only on what we know, but what other folks in the industry know. Having detailed questionnaires and checklists that are put together by experts such as Helen and other folks who contribute their expertise to these solutions and these products. Integrated back-end processes for reviewing their posture and reducing the burden of oversight, so that they have a system that collects the data and you can focus on reviewing and determining whether or not a vendor has met your requirements, as opposed to worrying about whether you've got the right documentation for them. Reduced resources in order to perform that function, because now you're doing the review piece of the problem as opposed to carrying the burden of the entire program. And last but not least, having discipline in the process so that you have confidence that for each and every vendor that you have, they've been classified properly, that the right information has been requested, and that you know if there are any gaps in their program. Next slide. So what we're going to basically present, and Jerry's going to talk about here in a couple of minutes, is a vendor security management service that we have put together in conjunction with COMPLYASSISTANT, where we take advantage of that COMPLYASSISTANT software to provide a fully managed vendor security management service to the covered entity. So basically, between CynergisTek resources with Jerry's software provide support to the covered entity by performing that vendor classification and setup, meaning all the vendors are set up properly in the system. We do the initial data collection and evaluation and provide a report to the covered entity, who then can provide the review. We then redress any of the issues that are identified by the covered entity with respect to the business associates. And then, depending on the classification of that vendor, on an annual periodic basis, there is maintenance performed. The documentation is updated, requests for new documentation is had, and this goes on automatically and is updated into the system so that the covered entity can go in there at any time and view this information and have an understanding and appreciation for how well their vendors are performing against the requirements that they've established for them. And last but not least, within a reasonable period of time prior to actual contract termination, there's an organized process that the vendor will be taken through to ensure that the data is handled properly at the end of that agreement. Any new vendors that come along as they are added are efficiently added into the system and go through the same process. And any new requirements that come along with respect to new rules, updates to the minimal necessary, updates to accounting for disclosure, for instance, are integrated into the requirements in the program automatically, so that the covered entity does not have to do that themselves. So it's a fully managed service that provides support to organizations that either have resource issues in managing this particular task or want a more organized and automated service and ability to be able to easily query how their vendors are performing. Next slide. So with that, I'd like to turn it over to Jerry and let him talk about COMPLYASSISTANT and how it plays.
Okay, thanks, Mac, and good morning, everyone. Thanks for your time today. Next slide, Jenna. So COMPLYASSISTANT, what I want to just talk about is that we have comprehensive functions for healthcare compliance management, in addition to what we're going to demo today at a high level. But there are these functions for dashboard, for tasking, of mitigation of risk, event management, also known as incident management, audit management, assessments, internal and external, risk management, and of course documentation, managing policies, procedures, plans, and attachments that are improving operational compliance. The external assessment function is the one we're going to focus on today, and it can be used in addition to monitoring BAs. It can be used for monitoring physician practices that are potentially owned by a covered entity. It can be used to survey conflicts of interest, and of course we're focusing on third-party contractors today, business associates, and there can be even more reasons to use COMPLYASSISTANT, the external assessment function. Next slide, please. So the thing we've talked about, and Mac mentioned, is that it's difficult to manage a process like this, hard copy, or in an unstructured approach like Excel or Word. For many covered entities, there is a large volume to manage with limited resources. And in addition, BAs now need to manage the subcontractors. Process requires creating an inventory categorized by risk, administering the process for pre-contract and for ongoing periodic assessments, communicating results, gaps, risk, and action, and making risk decisions. So, so with that, we'll go to the demo, and the next slide says that. You can turn it over to me now, Jana. And I will show my screen, and here we go. So I'm at the login. The scenario, again, is a covered entity using ComplyAssistant to assess their VAs. The objective is to provide a high-level look at how this function, the external function in ComplyAssistant, can make this daunting project more efficient to manage this process, and how it automates the documentation of evidence of due diligence for monitoring VAs. So let's take a look. What I'm going to do is log in. Now, I'm the assignor, so I'm the covered entity. And I'm going to go into the assessment function here. We have an external assessment called third-party BA. And we have a description that we put in there, and this description shows in the notification email that goes to the BA contact. So you can tailor that any way you like. The software has question libraries, and one of them is devoted to a covered entity monitoring a BA. We took a subset of that today, 8 questions. And we went into assign a monitor, and you can see that we already have 2 BAs that are set up. One of them has completed their assessment, and one of them hasn't started it yet. And to add another BA is simply to put in an email address. So I'm going to put in one of our colleagues, just to show you. Should have chosen a shorter email address to put in. Okay, so I click on Assign Assessment, and they get added to the list right up on top here. So that's a BA. So we have 3 BAs here. Now, for the one that I set up, which went to my Gmail address, so I'm the BA contact in a sense, what happens there is I did that, I signed it, the email went out to them, so they get notified. This follows the administration process that Mac talked about, so they're expecting this to happen. They get the email, it has a description of what it's all about, and they can click to take the assessment. First time they do that, they then activate themselves. And the nice part about this is by just sending them an email, they then come in and add all their information to ComplyAssistant. So in a sense, over time, you're building your business associate inventory details. So now we'll go back to the software. And I'm going to go ahead and actually what I'm going to do is go as a BA over here and sign in as the BA. So when they activate themselves and they come in, this is what they see, the name of the assessment, the description of it, and I've already gone in here and answered these questions. I can go back in and edit. So how it looks to them, I'm just going to give a full screen here, is they are presented with the questions. The first one here is, does your organization have a written security management program in place for information security? They can answer it, put in notes, and attach documentation as proof, whether it's policies, procedures, plans, operational proof, and they go to the next one. Now, going through this process can either be collaborative between the covered entity and the BA, depending on how big that BA is, how complex it is, or if they need help, or it can be done by the BA and without any assistance from the covered entity. So it takes a hard copy process and automates it. And at the end, when it's completed, what happens is there's an automatic notification that goes to the covered entity, and that's over here. And it says that the third-party one, that's the username, has completed an assessment. Click here to review. So you get automatic notification when it's done. So the objective then is for the assignor, comes in, and here's the 100%. You can view the report. And the process here then is to go through the questions, the answers, the notes. Notice there's guidance in here. You can assign risk and operational compliance levels. You can assign tasks to the business associate. There's reference information. There's the reference to the rule. And you can put in comments. And these comments can actually be tasks. So when I put in this comment right here, I tasked it, and it shows up right here as a task. So I'll go through the questions and do the same routine for all these questions and understand where the BA is at and what proof they have. And as I'm assigning the risk in the documented operational compliance, that's going to show up here in these graphs. So there's graphical feedback, which includes the operational compliance levels, the risk levels, how the questions were answered, who answered them, how many answers have notes, how many have attachments. And this then becomes the report that you can publish. So when it's published, do that right now. What happens then is an email goes back to the BA, and it's this email right here. Jerry Blast has published a review of your assessment. So now they know that they need to go in and review that. So going back to here, let's just go back to what they're going to do. They'll come in and they'll view the summary. They'll see the same graphs now that were populated by the risk and operational compliance levels. They'll see guidance. They'll have the feedback of comments and tasks, and they can go through it and see what they need to do. At that point, you probably want to go through and have some kind of a meeting with them to review it. Again, depending on how big they are, how you go about the communication process of what you found and what needs to be done. The other thing is that the business associate can also limit what they see here and then just go down and see quickly which questions and answers have tasks associated with them. So that's what they see. At any point in time, reports can be exported to either PDF or to Excel for ongoing. So basically, that's the demo for today. It was very quick and high level. If you did want to have a full demo of the software or more of a detailed demo of the external assessment function, you can go to our website right here and click on Contact Us and request that. Jana?
All right, well, we're a little bit over time, but if people can stick around, there's definitely a few questions. One of the ones that I've gotten from tons of people is wondering if they can get a copy of the presentation deck, and we can definitely arrange that after the webinar today. Another one that I have a similar question from a couple of people is wanting to know if your BA is unwilling to sign a BAA, then how can the covered entity learn about a possible breach within an appropriate time frame, and how should that be handled?
So I'm going to take this first, and then Helen, you can jump in here. But there's really two different questions here, I think. The first one is, what if a vendor is unwilling to sign a BAA? And if a vendor is unwilling to sign a BAA and you believe that that vendor is in fact a business associate, then the rule actually provides you with a way to address that. And what the rule says is that regardless of whether they sign the BAA or not, the minute they take possession of protected health information from you, they are a BA whether they like it or not, and that's the way the government is going to hold them accountable if something happens. But more importantly, if they're refusing to sign a business associate agreement, which means that they're refusing essentially to be compliant, you have an obligation to go back to that business associate and try to work that out. If you cannot work it out successfully, then the rule says that you have two recourses after that. The first one is to terminate that relationship, or if that is not possible because it will have a consequence to your business or to your ability to provide care that's not acceptable, you then have to report them to OCR, who will intervene with respect to the issue. So you can't just ignore the fact that somebody is refusing to sign a BA agreement. If you believe that they're a BA, you need to address it. The second part of that question, with respect to how will I know if there's a breach if they don't sign a BA, well, those are really not connected. If they, but they are in the sense that if they don't sign that BA agreement, then chances are they don't view themselves as a BA, which means that they also don't expect that they have any requirement to report anything. That's not a good situation. So bottom line is you need to have all of your business associates acknowledge that they are indeed a business associate and that they have those responsibilities and that they are willing to perform appropriatly.
I would just add to that from my experience in a practical level, when there's a refusal to sign a BAA, it's important at that point to get to the root of the refusal. the outcome of those kinds of, I guess, standoffs. You know, they usually end up in a couple of ways. Through me, so it comes around and understands the BA, or the covered entity and the BA decide, you know, look, maybe BA, what we really need here is a limited data set agreement, or in the end, maybe you do actually figure out that the services are not BA services. But in any case, if you do, if you do agree that the services are not BA services, your agreement, the underlying services agreement that you have with that vendor, you know, if you come down and the business associate, this is a recent case I just had, or a recent situation, B's like, we're simply licensing the software. It's installed on your site. We do not ever access the PHI. We do not ever host or hold the PHI. Everything is maintained on the covered entity site. We're simply providing a software license that then you manage on your end without any additional input. Well, maybe that's great, and maybe that we can conclude from those activities you are not a BA, but what I would recommend at that point, that the licensing agreement or the services agreement say things like you're providing a software that has certain level of encryption or certain level of safeguards that allows the covered entity to meet its responsibilities, i.e. the vendor has also safeguards in place that prevent or prohibit their people on their end from accessing the software and the PHI. So you may still want to talk about some safeguards that prevent that person who is not a BA from gaining access. So there's a discussion. So I think the takeaway really is anytime you get into a situation where there's a standoff, you know, it warrants a discussion with individuals who understand business analysis and contracts and what needs to be put into that, what kind of agreement needs to be placed, or what clauses need to be put into an agreement to adequately protect everybody in the end.
Thank you. Another question that I've seen that's pretty common, people are wondering when changes occur, other than when changes occur in the BAA, when does it need to be renewed? Is there a requirement to do it annually or any other type of requirement?
There's no, I mean, the HITECH requirement says that the amendments need to be completed and compliant, fully compliant. HITECH amendment or HITECH compliant BAAs need to be entered into as of September 23rd, 2013, or if they're in effect September 20, 2014. You know, a BA has to be in place immediately upon the relationship starting. Typically, the BAA addendum or whatnot is tied to an underlying services agreement, so it should be tied to the full length and scope of the relationship and a full time frame during which the business associate needs to continue accessing the PHI to perform those services and functions. So the short answer to your question, there's typically it's not like the security assessment and the security rule where you're supposed to update or review or redo or address the security assessment each time there's a change in circumstance, although you may want to you know, take a look at your BAA, because the one thing that there's no regulatory mandate per se that says you have to update, or it can only be for 1 year, or it has to be updated every year. But from a practical risk management and legal compliance standpoint, I've always said that the BAA is, and like any other contract, while you enter into it at one point and it scopes out certain things, if the nature of your relationship with the vendor changes in that, for instance, the scope of services increases or expands, or the things that you have they're doing has expanded, then yeah, you need to update the BAA for that change in circumstance, you know, in order to remain compliant, so to speak. So I don't know if Jerry or Mac have any additional comments to that end.
No, I think you're spot on. The only reason I could see the BA having to change after it's put in force with the contract is if the actual nature of the relationship changes throughout the life of that agreement, and then you'd want to do that. One of the things that I've suggested to folks when you're talking about security requirements, because you could have the nature of a relationship change such that a contractor a vendor at the beginning of a relationship may not be hosting information, but because of a change to the contract, they may end up hosting information, which would put them into a different classification and require additional requirements or different additional information that you would want from them in terms of vetting the level of protection that they were providing. It's always probably smarter to keep things that might ultimately change out of the BAA and make those an addendum to the contract itself in terms of a set of security requirements, because then you can, when you update the contract and update that, you can update those security requirements without necessarily having to redo your business associate agreement. But there's just different ways that folks want to go about that. That's more mechanical than regulatory. But I think that's really it. Unless there's a change, it should carry over through the life of the contract.
All right, and then the next question that we have is in regards to subcontractors and just being nervous that they're going to push back for being strictly liable for breaches, and just wondering if there's any guidance that you could possibly recommend to address this issue.
Well, HITECH and the breach notification rules, I guess this gets into a little bit of a legal, I suppose, law school class, but I mean, it's not a strict liability, statute. If you have certain duties to discover, reasonable duties that you, even as a sub-vendor, if you're holding PHI, you need to be doing certain things and start with taking a look at the security rule. I mean, the administrative, technical, and physical safeguards and their implementation specifications give you a roadmap of the things and the types of things that you should be implementing to identify certain breaches. So you do need to take certain steps to try to ensure that you can't just be an ostrich and stick your head in the sand and say, I don't want to know about it. As part of your duties to comply with HIPAA-HITECH, you should be doing certain auditing functions, having certain things in place in order to help you discover or prevent the breach from occurring. Once you have knowledge, if you don't have knowledge and you are doing reasonable things to discover, but you still just don't know, the fact that you don't know, knowledge is the triggering event, and that's why I'm saying it's not really a strict liability statute. Knowledge is an element that needs to occur before your duty arises to notify your business associate of the discovered breach or incident. So once you've obtained knowledge of the incident, you have to disclose it as a matter of your regulatory compliance requirement. As far as liability, that is a negotiation point. Who's going to be responsible for what costs in terms of costs associated with damages or anything along those lines, or penalties? That is something that you need to, quite frankly, own up and insure for, take responsibility to some extent, but there is certainly going to be a power struggle in terms of negotiation, and the bigger vendor may win. If the BA is going to demand that you do certain things, then you may not have any choice but to accept them or not accept them in order to enter into the relationship or not. So it certainly is who's going to pay for what in terms of liability in the end. Indemnification or insurance or otherwise, comes down to contractual negotiation.
All right, thank you for that. I think we're getting a little over our time here, so I think it's time to wrap up. Definitely you can reach out for any further information, any further questions you have. Feel free to reach out to any of us. And anything that y'all have any closing remarks? Jerry, Mac, Helen?
Yeah, first of all, I'd like to thank Helen for participating and providing that great overview of the requirements for business associates, and for Jerry demonstrating how the software supports the program and helps organizations meet their compliance requirements. Again, this was the purpose of this presentation today was to, one, educate a little bit on what's coming down the pike and what we need to be ready for as business associates and covered entities to manage these relationships properly and do a good job and make sure that we meet our compliance requirements and limit our liability. And secondly, to provide you with some information around both a service that can help you accomplish this mission, as well as some tools that help as well. So again, thank you very much for coming today and listening. And if you have any questions, please feel free to contact us.
And I would also like to give a thank you to Helen and Mac and to everyone who attended today.
And thank you for having me. It's my honor to be able to be a part of this, and I appreciate to Mac for inviting and Jerry for coordinating. It's been my pleasure and privilege.
All right, Jen, I think we're good.
Thank you, everybody.